Are you worried about what books to read in MBBS first year? Don't worry. As a senior, I am here to help you as we have been through that already. But before going into the video, I would like to give a disclaimer, which is that this video is meant only for those who want to make their concepts crystal clear and want to become good doctor so that they are able to diagnose patients well and also give them good treatment. If you are wanting to buy books only for passing exams, this video is not meant for you. Please close the video and save your time. So as you are already watching this video, I hope that you are interested in knowing about books which are going to help you in making good concepts and also becoming a good doctor. So let's start with a few principles based on which we would choose some books. So the first principle is that the book should not be bulky, because a bulky book will have more content which will take more time and effort from your side, and this will make completion of the book a difficult task. Second thing is that the book should not have too much text, because too much text will need too much time from your side. The third thing is that the book should have clear diagrams which explain the concept well, so you are able to understand the concept really well without spending too much time reading the paragraph. And the fourth and the final concept is that the book should have really strong clinical correlation, so that you are able to understand that whatever you are reading is going to be helpful in the future, because then only your interest in that book, in the topic, is going to develop, and only when you are interested in a topic you will be able to perform better in academics and also in the real life. So with these basic principles, let's move on to finding the best books out there, starting with the first and the most important subject, anatomy. When it comes to anatomy, many students are afraid of this subject, and the reason is that they follow a book which is not actually a book, which is just a note. It is a note of anatomy facts randomly spread out and very poor diagrams. For example, I will show you what I am actually talking about. So I think you have guessed about the book I am talking about. This is Biochemistry, and here I have a front page of the 10th edition of Biochemistry, which clearly states that easily reproducible line diagrams repeated from hand diagrams of Dr. Biochemistry. So the book is completely exam oriented. It does not care whether you are getting concepts or not. So the books that I am going to recommend are the ones that are going to develop some really fantastic concepts. Anatomy is usually divided into the four main parts: gross anatomy, histology, embryology, and neuroanatomy. Starting with the gross anatomy, for which this Biochemistry is usually followed, my recommendation would be something which is called Gray's Anatomy. This is a great book which has really great diagrams. For example, this is the diagram of bones of hand. It has given x-rays. The text you can see is not too much, because almost half of the page is gone in diagrams and only half is text. Here also you can see the book is not loaded with text, so you don't have to read much. You have another diagram which is depicting ligaments. Then you have the bones of the wrist joint in the x-ray. Then you have another diagram, some little bit of text. So this is a great book for making some great concepts and understanding the topic well. It has great clinical correlation, so you actually know what are you reading for. So this was about gross anatomy. For gross anatomy, Gray's Anatomy for students is the go-to book. You don't have to think about any other book. This is the best book. However, if you want to excel and you want to read a bit more, I would recommend one book which is Murray's Clinical Anatomy. Now this book is a bulky one, so I will not recommend you to go and read the entire book. But one thing this book has great is that it has blue boxes which has clinical correlation. So for example, I was reading one day about clavicle. Clavicle is a bone, collarbone right here. So you will usually read in anatomy that the medial part, the inner part is convex like this, and the outer part is concave, something like this. But why is that important? So this clinical correlation makes things important, that the junction of this convex and concave part is a weak point. So if anything, any trauma occurs, the bone is going to break from this side, and the book actually gave a diagram. When the bone breaks from here in middle, the weight of the hand is going to pull the outside part down, and the inside part is going to be pulled up because of muscle which is connected uh, here like this, sternocleidomastoid muscle. So this is how a patient is going to come in your OPD. So this thing makes learning very interesting, and when you have interest in something, it is going to be far more productive. For example, let me give you a quote. There is this person Ali Abdal on YouTube. He's a doctor, also a productivity guide. He makes a video about how to be productive, and one of his quote is that if you want to be good at something, you need to make it interesting. Okay, so with this, let's move on to the next part, which is histology. So histology is a subject about the tissues of human body. It involves a lot of microscopy. So this is something which we think is not important in the first year, but as soon as you enter the second year, you study pathology. Every disease you have to study microscopic. So there is a disease of bone, there are going to be some changes in bone, you have to know the microscopy. Disease of kidney, microscopy. Disease of brain, microscopy. Every disease has its own microscopic characteristics based on which it is diagnosed. So it is very important to know histology of the disease. The book which is usually followed is IB Singh, which is again a note. It's notes and nothing else. It is completely exam centered. What I would instead recommend you is a great book which goes by the name Defoe's Anatomy. It is not a very lengthy book, but it has really nice diagram. It goes by the name of Defoe's Atlas of Histology. This is the book I'm talking about. The reason I'm not having the books because there are a lot of books, and I am using the tablet to show what all books you need in one device. So this is actually an atlas. It does not has a lot of text. So you can see images, and then more images. But one problem with this book is that it has diagrams and not actual images. So what you are going to see in a microscope is not what you are going to see here. So to overcome this problem, I have got another book for you. So this is an atlas. Atlas is something which has diagrams to make the concept clear, and the text is only to explain the diagram. So this book is a very heavy book. I am not going to say that you read this book cover to cover. I actually went through this book for its diagram, for its images. So what it has these images, real images for microscope. So when you are in the histology lab, you can actually correlate those findings from that microscope with these images, and this makes learning very interesting and easy. So it goes by the name Ross and Pavlina Histology Atlas. So you don't have to read this book, but the images are really good. So you can go to the diagram through the images to make your concepts really clear. The third part of anatomy is embryology. So embryology is the study of how the human develop from fertilization to the birth. It also includes events before fertilization. Again, the book which is usually followed is IB Singh, and the reason we have these books followed is that they are easily replicable. So you are going to copy and paste them exams without actually understanding it. And the big problem with such an approach is that you would be able to score decent amount or even good marks in the exam, but within a few months, within a few weeks, you are going to forget everything if you study from such a books. IB Singh of Embryology usually followed, but I won't recommend this book. I would rather recommend a book which goes by the name Langman's Medical Embryology. Langman's Embryology is a short book. The size is small. This is how it looks. The cover page. The latest edition may have different cover page, but what I am interested to show you is that this book has some really great diagrams and clinical pictures. So you can see there are a lot of diagrams, great diagrams, not too much of text in here. Clinical correlation. So this is an abnormal baby which is born with some defect. So the embryology explained and what could go wrong, it also is explained here. It has really some good diagrams to make the concept really clear to you. and the text is not too much, so it is not a big deal to complete this book. So this was embryology. The next part, the fourth part, is neuroanatomy. So neuroanatomy is a subject which is very very important. This is something which I do myself regret, because I did study neuroanatomy, but I did not revise it frequently enough. So when I go to medicine wards and seeing neuro patients, so to understand neurology, the physiology part, you need to have really strong concepts of anatomy as well. If you don't have a good anatomy base of neuroanatomy, you are not going to understand anything in physiology. And any case of neuro, like a case of a stroke for example, you are not going to it becomes impossible for you to diagnose it, and without diagnosis you are not going to treat the patient. So this is a very important part of the anatomy which is usually ignored. So the latest edition of Gray's has a neuroanatomy section, the older edition do not. So you don't have to buy a complete a separate book for this. So some people think that osteology is a different subject on its own, and they treat it as if it needs a different book, but I don't think so. If you use Gray's Anatomy for your studies, the book itself is too good that you would be able to learn about the bones in the book itself. You don't need another book for osteology per se. Now I want to show some resources that would really help you. I want to show you something which is very useful for anatomy, which is an application of Atlas. So this is an application where you can interact with the app itself and learn about bones, about muscles, about different organs. The app which I use in my tablet is Anatomica. So this is how it looks like. It has a whole skeleton in front of me. If I want to study any bone, I need to click on it, then isolate. So I will be able to study a bone all by itself. I can study about different parts by clicking on landmarks. Different apps have different names for the settings, but all apps do serve this purpose. You would be able to learn about the bone, about an organ in detail. So these apps are great. They work both on phones and tablets, and you don't necessarily need to have a tablet for such an app to learn. So this was for anatomy. One more important thing which I think you need to know about anatomy is that in examinations you need to have really good diagrams in your answer sheet to be able to fetch really good marks. And the book I would recommend to get really good diagrams for examination purpose is Vishram Singh. So Vishram Singh has some single line diagrams, the diagrams which can be easily drawn by pencil or pen. So unlike diagrams for BDC which are hard to draw, diagrams for Vishram Singh are relatively very easy to draw. Everyone find it's very easy to draw diagrams for Vishram Singh, so this is highly recommended. So studying from Gray's Anatomy, making the concepts, and then in exam, copying the images from Vishram Singh would be able to fetch you some great marks. Now next is physiology. Physiology is also a very important subject. It builds your foundation for pharmacology, and is very important for medicine and for everything that's as such. For physiology, the books which are usually followed by students are Guyton and Ganong standard books. Some other books like Symbolingam, etc., are not at all recommended for the same reason. These are just notes and not a book as such. So Guyton, I would like to show you one thing about Guyton is that it is a really bulky book. As I have told earlier, you need to have book which is not bulky, so you are able to complete it in time. If you are confident that you would be able to complete Guyton within the limited time, it is good. So this is the page of a Guyton. The text is small, there is too much of text, even though diagrams are great. If you find that you would be able to complete this book, really good. Many students do it, but if you think that this is overwhelming, you wouldn't be able to complete this book, then you should be opting for another book, which is Guyton has really easy language, so reading the book in itself will not be a challenge. The thickness of the book is a problem for many students, so make sure you would be able to complete the book before buying it. Otherwise, try Ganong. Ganong is a relatively crisp book. It is more concise, but the problem is that Ganong has got a bit difficult language. So if you are comfortable with the language of Ganong, this is your book. You can go with easily and trust it. Uh, so Guyton and Ganong, I would say these are like both of them are good books. You should try Ganong first if the language suits you, well and good. If not, you can move to Guyton. So it's on the easiest side of language, but the content is too much to read, even though diagrams are good. If you are really short on time, you cannot read either Ganong or Guyton. I would recommend you some other book, which most likely no one has told you up till now, because this is the book which is not usually followed in India. This is a book which is used by USMLE students, and it is considered a gold standard for USMLE examinations of physiology. So the book I'm talking about is uh, Costanzo Physiology. So Costanzo Physiology is a short book of about just 500 pages. So this is the cover page of Costanzo Physiology. This edition is quite old, from 2018. The newer editions would be a bit different, more updated. But this book is not available in India because this is mostly an American book read by American students. So you may have to get a printout of this book if you want to read it. The great thing about this book is that it has really great diagrams and images and charts. Also, it has big text which is not very difficult to read. So this book is a great choice if you are short on time, or if you are underconfident that Guyton or Ganong will be too much for you. You may try this book, but it comes with its own problems, like it has some missing topics. For example, the chapter blood is completely not in this book. Otherwise, this book is a very good book to go with. I myself have read many chapters on this book, but I would rather recommend to go with Guyton or Ganong if you want really good concepts, because they are going to be very helpful in the future years. For physiology, also many people recommend separate books for physio lab. I won't recommend any particular book as such for laboratory, because most of the information which you need for lab are already present in your main textbook like Guyton or Ganong. So you don't need a separate book. Too many books are not always a good thing, because you also need to complete those books. What I would rather recommend is that very specific topics you need to study apart from your main books. For example, pulse, types of pulse. This is something which is usually very favorite question of the examiners, and if you don't find it in the book itself, then only you have to go for any other supplementary material. Otherwise, you need to have as little resources as possible, so that you are able to have command on all of them, rather than jumping from one source to another. If, however, you want to develop some clinical skills from the early years, I would rather recommend to go with Macleod's or Hutchison's clinical examination books. These are very good books for studying examination method, how you examine a patient. How, for example, a patient has come with a problem of heart. How would you examine it? How would you listen to the heart sounds? How would you look at his chest and things like that? So Hutchison and Macleod's are really great books, and they are useful up until your final year in medicine. So it is a good investment. Coming to the final subject, which is biochemistry. So biochemistry is a subject which is not very important like physiology or anatomy, but it still has to be devoted considerable amount of time in order to be able to master something, because almost every patient has some investigation which has something to do with biochemistry. So understanding biochemistry is very crucial to understand a disease and how it manifests. The book which is popular for biochemistry is Lippincott. This is a great book. The good thing is that it is on bulky, around 600 pages or even less than that, and the text is not too much, so you would be able to complete the book easily. And also, it has really great flowcharts and diagrams. This is the Lippincott right here. So the book has lots of flowcharts, lots of diagrams. This is a chapter of glycolysis, which all of us have already read. So the text is not too much, as you can see. Every page has diagrams and flowcharts to make things easy, and these diagrams and flowcharts really come very handy in examinations. So you are able to solidify all that you have written in text in the form of flowchart, in the form of a diagram, or in table, and this fits really good marks. So Lippincott is the book to go with for biochemistry. But if you want something better, something more informative, then for the metabolism part, metabolism of carbohydrates and proteins and lipids, you can read Harper. It is a great book. It makes the concepts of metabolism really clear. But if you don't want to go with Harper, Lippincott is still the best book in terms of its size and the information it conveys. I would like to share one incident which happened to me. I was in first year when a sectional examination on the topic of minerals was to be conducted. I read the topic from the Lippincott, which is only one chapter. So after I was finished reading, I thought I need to study more. But as there was only one chapter in this book, I went to another book which goes by the name Vasudevan. I never studied that book up until then, but as it had two chapters on topic of minerals, I wanted to go with it. I started reading on the first page itself. There were so many facts. I thought it's just unnecessary because I am going to be a doctor. I don't need to remember all these values. I'm going to see a patient. And just after a few pages, I closed the book. I started to feel something like headache. So you don't need to go with these books which are lots of information, lots of facts, because you are becoming a doctor and not some chemical engineer or something. The books I mentioned are really great. Some other thing which I would really recommend you to go with is case files are books which has questions in the form of cases. So if a patient comes in with some problem, it has whole description of the patient, the problem, and it asks you question, how are you going to deal with the patient. Case files is available for anatomy, physiology, and biochemistry. I would really recommend you to go with that and solve the problem so that you are able to connect whatever you are learning in these books with real life situations. This makes the learning process very interesting and really gives you an edge over your peers, because when you have really in-depth understanding of a topic, of a subject, you are able to manage a patient much better. I would also like to emphasize on one topic which many students go wrong with, is that many students buy one book for studies in the normal days, and when they have exams, they buy another book, short book for writing examination, which is completely illogical thing, because if you are reading a book the entire time, then you can, if you switch the book to some other book, even though the new book is short, but you have to read that book over again, and this would take more effort, more time than reading your previous book. So make sure you have just one book per subject, or if you are referring to some other book for some topic, for example, if you are reading Harper for metabolism, then metabolism should be read only in Harper and not in some other book. So what I would really recommend is go with one book, master it, read it, revise it multiple times, and even in the exams you have to write from the same book. And if you have read it enough, if you have revised it enough, this will also benefit you immensely in your postgraduate examinations as well, NEET PG and next. This was my guide to reading books. So here is a complete table of all the books that I have mentioned. Take a screenshot of it and save it somewhere. If you are interested in knowing what an MBBS student should do just after getting admission, here's the link of the video I talked about. Until then, goodbye.